What if everything you were told about peripheral neuropathy was wrong? There's an enormous amount of neuropathy information that is completely inaccurate and completely outdated, but it's still being told to patients by their well-meaning doctors. Today, I'm going to bust the most common myths about peripheral neuropathy that are holding you hostage and ruining your life. Hi, I'm Dr. Valerie Montero, leading expert in peripheral neuropathy, co-author of the critically acclaimed book, Defeat Neuropathy Now in Spite of Your Doctor, and the ebook, The Great Neuropathy Hoax, and co-founder of Neforious CM. My mission is to empower each and every one of you so you're not resigned to giving up and just living with this horrible condition. Do you know there are 24 million people currently suffering from peripheral neuropathy, and this number continues to grow each year? If you're watching this video, chances are you or someone you love suffers with peripheral neuropathy symptoms that can become debilitating. Symptoms like numbness, tingling, burning, pins and needles, lightning bolt-like pain, loss of balance, and more. Well, it's time that you knew the truth. There is hope, and your nerves can heal and regenerate. This isn't just my opinion. This is based on the scientific evidence that has been published in well-respected medical journals. In fact, it may shock you to find out that there are some countries in Europe and parts of Asia that have been successfully healing peripheral neuropathy for well over 30 years. But here in the US, less than 1% of the doctors know how to successfully reverse damaged peripheral nerves. So why is this, you might ask? Well, there are a couple of reasons. First, according to a study published in the Journal of the American Medical Association, it takes over 23 years for well-researched information to make it into clinical practice. 23 years. Secondly, pharmaceutical companies are earning approximately $4.2 billion a year on Lyrica and the generic pregabalin, and another $2.9 billion a year on gabapentin. Not to mention, they're earning $4.9 billion a year on Cymbalta and duloxetine. So, do you really think that pharmaceutical companies are eager for you to learn about a drug-free, safe and effective treatment to heal your damaged nerves? No, they're not. And they'll do everything in their power to block and undermine the widespread publication of the research studies. Because of this, it takes quite a bit of digging, not to mention time, for doctors to find these clinical studies. The average doctor doesn't have the time, nor the motivation to go hunting for the information. As a result, most doctors, including neurologists, remain outdated in their information. And that's the reason that 99% of doctors in the US continue to circulate inaccurate information about peripheral neuropathy and recovery. Okay, so let's get started with busting these neuropathy myths. Myth number one, nerves don't heal. Once they're damaged, that's it. That is absolutely false. Tell me in the comment section if you've heard this below. Peripheral nerves can and do regenerate after they've been damaged or an injury has occurred to them. This has been proven in many clinical studies, including studies done by Harvard Medical School and Massachusetts General Hospital, which is ranked in the top 5 for best hospitals in the United States. So here's an example. Every year, there are thousands of cases of people who have cut off fingers, toes, and even people who have severed an arm. These people have had their digits or limbs surgically reattached, and with time for healing and physical therapy, they can regain function. If peripheral nerves didn't heal or regenerate, it would be impossible to reattach fingers, toes, or arms. So peripheral nerves absolutely can heal. Many times, they just need additional assistance to begin the regenerative process. Now, myth number two, there is no cure for peripheral neuropathy or damaged peripheral nerves. This is 100% false. So when a doctor goes to med school, they're taught that peripheral nerves have the full capability to heal and regenerate. We're taught this in school. Then we get out of school and we begin to forget our basic physiology and neurology. So while in practice, after not seeing any changes in peripheral nerve patients in a couple of weeks, we then come to the incorrect conclusion of, hey, they just don't heal. So most doctors then go on their merry way and never think twice about it. All the while, 24 million people continue to suffer and become disabled from this horrible condition. I'm embarrassed to admit that I too was one of those doctors until it directly impacted my life when my mother developed a severe case of peripheral neuropathy from chemotherapy. It left her debilitated. So ironically, her cancer went into remission, but she wasn't able to celebrate that momentous occasion because her symptoms destroyed her quality of life. At this point, I wasn't willing to sit back and watch her suffer like this. So that's when I set out to find a solution for her condition. And I was shocked to discover that some countries in Europe and Asia have been successfully reversing peripheral neuropathy for well over 30 years. In fact, that's how I came up with the protocol to reverse my own mother's severe neuropathy. I utilized European clinical protocols and it worked. Her damaged peripheral nerves healed. All of her symptoms resolved. No more crying herself to sleep at night from the pain. She was able to get rid of her cane and get back to living again. Although I followed European research, I'm pleased to say now here in the US, there is more research than ever that's proven peripheral nerve damage can be repaired. One way to facilitate nerve repair is by taking critical nutrients shown in clinical studies to facilitate nerve regeneration. Nutrients like R-alpha-lipoic acid, a fat-soluble form of vitamin B called benfotiamine, a specific form of vitamin B6 called pyridoxal 5-phosphate, and the natural form of vitamin B12 called methylcobalamin. These have been proven to be highly effective for aiding in the repair and regeneration of peripheral nerves. Other critical nutrients that help to restore peripheral nerve function are acetyl-L-carnitine, L-citrulline, and folate. In fact, that's how we came up with our formula, Neuphoria CM Gold and Blue for nerve repair. We gathered all of the data from the research to develop our neuropathy support formula. Research has also revealed that the use of near-infrared laser therapy, also known as low-level light therapy or LLT, is extremely effective for repair and regeneration of peripheral nerves. So you might be asking yourself, why doesn't my doctor know about this research? Unfortunately, most doctors, regardless of their specialty, are overwhelmed with a large volume of patient care, leaving them little to no time to stay on top of the current research. And let me tell you, it's no easy task to stay current with the research, especially when Big Pharma is doing anything and everything in their power to bury everything that isn't related to drugs that they can make billions from. When I was digging through the research for repairing peripheral nerve damage, I literally spent over 100 hours looking for a solution. But remember, I had a huge motivating factor. My mother's quality of life depended upon it. Most doctors don't have the time, nor do they have the same motivation that I had. Statistics show that here in the US, less than 1% of doctors know how to reverse peripheral neuropathy. Dr. Coppola and I are working to change that statistic. We now have a training program for doctors teaching them how to reverse and repair peripheral nerve damage. So let's move on to myth number 3. Only people with diabetes develop peripheral neuropathy. This is completely inaccurate. Statistics reveal that diabetic patients only account for 1/3 of all neuropathy cases. So that means out of 24 million Americans afflicted with peripheral neuropathy, only 8 million are from diabetes. Now, if you do have diabetic neuropathy, one of the most important things that you need to do is decrease your glucose levels and maintain them. You'll be hard-pressed to accomplish this with medication alone. You need to make dietary changes. Here's a surprising fact. A 2009 study published in the Neuropathy Association revealed that for every diabetic neuropathy patient, there are at least 6 more patients suffering with other various forms of neuropathies. Peripheral neuropathy can be caused by things such as chemotherapy, medications, for example, cholesterol-lowering medications known as statin drugs, and high blood pressure medications called calcium channel blockers like amlodipine or Norvasc. There are other causes of peripheral neuropathy like prediabetes, B vitamin deficiencies, alcohol abuse, daily alcohol consumption, surgeries, irritable bowel syndrome or inflammatory bowel disease like Crohn's or ulcerative colitis, gluten sensitivity or celiac disease, autoimmune diseases, kidney disease, and thyroid disease, to name just a few causes. Next myth, number 4. My neuropathy symptoms are well controlled by medication, so I'm doing just fine. Well, not only is this false, but this line of thinking can get you into big trouble down the line. Here's what I mean by that. Medications like Lyrica or the generic pregabalin, gabapentin, Neurontin, Orgrelis, and Cymbalta or the generic duloxetine only mask the symptoms associated with peripheral neuropathy at best. They don't prevent the nerve damage and they do nothing to repair the nerves, and the underlying condition will continue to worsen with time. Medicating peripheral neuropathy symptoms is like taking the battery out of your smoke alarm to stop the noise, but you never called the fire department to put out the fire. If all you do is medicate your peripheral neuropathy symptoms, with time you'll find that you need to take higher doses of these medications to get the same pain relief, until one day you've reached the maximum dose of the pain meds and it's no longer working to control the symptoms. Yes, controlling neuropathy symptoms is very important because they can be debilitating. But make sure you're addressing the root cause of your neuropathy and working on repairing the damage that's been done to the peripheral nerves. Myth number 5. My symptoms are very mild and don't interfere with my life, so it's no big deal. This is false. Many neuropathy sufferers who only suffer from mild numbness or tingling can function without any problem. These symptoms may only be a mild inconvenience, so they think, it's no big deal. They can wait. These mild symptoms, they'll probably just go away on their own. Well, what they don't understand is that what they're feeling is only the tip of the iceberg. However, a study published in the British Medical Journal showed that 75% of peripheral neuropathy sufferers who did nothing about the numbness and tingling had either pain or disability 12 months later. Multiple research publications have revealed that if ignored, the symptoms can intensify, causing loss of sensation, unremitting pain, and yes, even disability. Well, thanks to one of our YouTube subscribers, McKay James, he told us that it was virtually impossible to find on the internet what the stages of nerve healing would look like and feel like. So he asked us to film this episode. And as always, we really take your requests to heart. So I'm going to break this video up into 3 parts. So let's dive in with part 1, the healing journey of the damaged nerves. This is a broad topic, and I'll answer several questions under this topic. First, what do damaged nerves feel like when they're healing? Well, there's no simple answer for this because it literally will depend on which nerves have been damaged, like motor, sensory, or both. Motor nerves, the nerves that allow for muscle movement and strength, will typically take longer to heal than sensory nerves, which are the nerves that process sensations. I won't go into great detail about this right now because I already shot a video on this, and the title of that video is What is Peripheral Neuropathy? But I'll include a link for you in the description box down below so that when you're done with this video, you can take a look at it. The other factor dictating how the nerves will feel when they're healing is the extent of damage to the nerve and how long it's been there. So let me try to get a bit more specific. There are a small group of people who, when their nerves are stimulated through treatment, their symptoms will get worse before they improve, meaning their symptoms might intensify for the first couple of weeks during their treatment. Neuropathy sufferers who may be prone to this are people with significant mitochondrial damage in the nerve cells. Also, chemotherapy-induced peripheral neuropathy cases may tend to notice this. People with high levels of systemic inflammation, which you'll find in people with heart disease, fibromyalgia, arthritis, or GI issues like IBS, Crohn's, ulcerative colitis, and even anorexia. Also, peripheral neuropathy sufferers who already experience an acute sensitivity to touch as a symptom will tend to experience a worsening of their symptoms at first. Now, I know this may be alarming because you're thinking, gee whiz, my pain is already bad enough. I don't know if I can take it getting any worse. First, let me say that this is only temporary. It will only worsen for a few days up to a couple of weeks max. There are some exceptions to this rule, of course, especially if we're dealing with people that have incurred their neuropathy due to chemical exposure or toxicity. One thing we recommend if you fall into this category is decrease the dosage of your nerve support formula in half for the first 2 to 3 weeks. Or if you're using a good quality near-infrared medical device, you'll cut your time down to maybe only 5 to 10 minutes daily to start with for the first 2 to 3 weeks. Then you'll slowly increase it with time each week. This will generally get your nerves acclimated so they're not really repeatedly firing, causing your symptoms to elevate. Patients always ask me, will all my symptoms go away at the same time? And the answer is no. It's not black and white, meaning you won't go from having symptoms for years and then suddenly, bam, they're all gone. But here's a piece of good news that you can expect during the healing process. Your ugly pain will be the first to regress. This is a term that we use for the severe neuropathy symptoms that you may be experiencing. So, for instance, let's say you suffer with a sharp lightning bolt type of pain, along with severe burning, throbbing, tingling, and numbness in both your feet. The first changes you'll see is a decrease in the sharp lightning bolt pain, or in this case, the most severe symptom. However, the symptoms that will take the longest to diminish and recede are the tingling and the numbness. Typically, numbness is one of the slowest symptoms to dissipate. It will alleviate to various degrees a little at a time. As your numbness rescinds, it will go through many shades of gray. One other symptom that will take even longer than the numbness to recover from is your balance, especially if it's been extremely poor, causing you to stumble or fall. The reason balance takes so long to recover is because the muscles need to be strengthened and the nervous system has to be retrained or reprogrammed through specific exercises. We call this the nervous system reboot. You can use our exercise video to help with your nervous system reboot. Don't worry, I'll provide the link for you for that as well in the description box. Also, another exercise that's very effective for your nervous system reboot is using a whole body vibration machine. You can purchase a standing unit with handles to help you maintain your balance. The equipment really does a phenomenal job at rewiring your nervous system to improve your balance mechanisms known as proprioceptors. Here's another question we commonly get. Does the healing from nerve damage happen in reverse? This is a great question, and the simple answer is yes, it does. Let me give you an example. If your symptoms began in your toes, then spread to your foot and up to your calf, your symptoms will dissipate in the reverse order. They'll begin to diminish in your calf first, then your foot next, and lastly will be your toes. This holds true for all of the symptoms except for numbness. Numbness is the last to go, no matter where it's located. Likewise, if you're dealing with symptoms in your arms and hands, then your fingers will be the last to have the symptoms recede. On to part 2. How long does recovery take? This by far is the number one question I get asked. And as I've mentioned before, the recovery time will vary from person to person with several factors influencing this variable. And I'll go over those in just a second. But the first thing that you have to realize is that nerves are the slowest healing tissues in the body. In fact, research reveals that a peripheral nerve will only heal 1 inch per month, which might sound like a lot, but it really isn't because we have about 90,000 miles of peripheral nerves in our body. If you were to lay them on out end to end, they would stretch on out for 90,000 miles. So now, take this already slow process and throw in other elements that can hinder the healing process of your nerves. This includes medications, both prescription and over-the-counter that you might be taking. Other chronic illnesses you might have like diabetes, heart disease, kidney disease, autoimmune disorders, thyroid problems. Also, eating a standard American diet of processed food. drinking alcohol regularly, not getting enough uninterrupted sleep each night, lack of exercise. Any or all of these factors can impede your recovery substantially. So let me give you a general guideline I use with my patients so they understand what they can expect to see for improvement. Remember, these guidelines are not set in stone because they'll vary based on all the factors that I just mentioned. But let's say, for instance, you're a typical neuropathy patient and you're on 1 to 2 medications. Maybe you have another mild medical condition and your diet is like every other American's. Well, if you've had your neuropathy for 6 months to a year, this person may take up to 3 to 6 weeks before seeing even small changes in their symptoms. If you've had your neuropathy for 1 to 2 years, it could take up to 2 months for this person to experience any changes in their symptoms. And if you've had your neuropathy for 2 or more years, this person may take as long as 3 to 4 months before they notice changes or a lessening of their symptoms. Now, I just went over how long it takes before you begin to see improvement in your symptoms. But you might be saying, well, that's helpful and all, but can you tell me how long before my nerves are completely healed? The Mayo Clinic has done research that shows it can take anywhere between 8 months to 2 years for peripheral nerves to fully heal. But bear in mind, this will depend on how proactive you are in your healing journey. For instance, have you made changes to your diet to reduce inflammation in your body? Are you doing the neuropathy exercises I provided for you or any sort of physical therapy? Are you meditating and keeping a positive attitude? Whew, this one is a big one. In fact, we'll be doing an entire video on this topic because it has a huge impact on your recovery. And lastly, are you effectively managing your glucose levels if they're elevated? If you're doing any or all of these things, you might reach full recovery in a year or less. However, if you're not doing many of these things, well, you're looking at closer to a 2-year span for recovery. Also, if you're using near-infrared light therapy, this will most definitely speed up your healing process. But before you run out and buy a unit, there's a lot you need to know before you spend your hard-earned money. There's so much junk on the market that's completely ineffective. Let's move on to part 3. Is the healing process the same for each peripheral neuropathy case? I can answer that with one word. Absolutely not. Okay, well, that was 2 words. Your recovery will be dictated by a bunch of things, including the inner terrain of your body, your lifestyle, and your attitude and outlook on your recovery. Healing will be extremely slow for a neuropathy sufferer who falls into the following categories. You're not consistent with your treatments. This may be consistently taking your nerve support formula or doing your infrared therapy daily. You take medication regularly. Doesn't matter if it's prescribed or over the counter. You don't monitor or control your diabetes or prediabetes. Your diet ranges from bad to horrific. You drink tons of caffeine. You drink very little water. You drink alcohol regularly. You get very little sleep. You get no exercise. You don't believe you'll ever get better. A combination of any of these things can grossly slow down the healing process or prevent the nerves from fully recovering versus a person who is very compliant with their treatments. They don't take any medications and they make lifestyle changes. Well, they're going to heal much faster and with better results. The good news is most of the things that I just listed are fully under your control. You can make small changes in your lifestyle and eliminate some of the self-sabotaging behaviors to facilitate more rapid and more complete nerve repair. As for the medications you might be taking, you'll find that once you change some of these other factors, your body may no longer need a few of the medications that you're on. Here's an example of what I'm talking about. We had this patient, Josie, who was 70 pounds overweight, diabetic with her morning glucose typically ranging from about 150 to 180, and her hemoglobin A1C was at 7.4, which is very high. She drank 4 to 5 cups of coffee daily using a 16-ounce mug, and she used Splenda as a sweetener. Her diet was loaded with carbs and sugar and next to no vegetables. For medication, she was on 2 blood pressure meds and a diuretic for swelling in her feet and her ankles. She was on metformin and insulin. She took a statin drug for cholesterol and a sleeping pill to help her sleep. Not making this up, folks. This is an actual case history, and this is much better than the usual case histories we've seen from most of our patients. Well, when she came to us for treatment of her peripheral neuropathy, she rated her pain levels at a 12 on a scale of 10, with 10 being the worst. So you could see that her pain levels were really bad. So we started her on treatments for peripheral neuropathy, which included our nerve support formula, near-infrared light therapy, the whole body vibration exercise, and a foot pedal exerciser. We placed her on a ketogenic diet. We replaced her 4 to 5 16-ounce cups of coffee with 2 8-ounce cups of organic coffee. We changed her toxic sweetener to a safe, diabetic-friendly sweetener called monk fruit, and we had her drinking 64 ounces of water every day. Within 2 months, her symptoms had decreased from a level 12 out of 10 to a 6 out of 10. That's just about in half. She lost 20 pounds. Her morning glucose levels dropped down to between 115 to 120, and her hemoglobin A1C had decreased to 6.3. On top of that, the swelling in her feet went away, and her blood pressure dropped just from the lifestyle changes that she made. So her doctor was able to eliminate her diuretic and also one of her blood pressure medications. And her doctor also reduced the dosage of her statin drug because her cholesterol level had improved substantially. She was also taken off of metformin, and the units of insulin that she had to take twice a day decreased. She also no longer needed the sleeping pill. So this is huge. So you can see by making simple lifestyle changes, it can have a significant impact on your need for many medications. Now, the last question I'll cover in this video is, once my peripheral neuropathy is healed, will it come back? This is a great question. And the answer is, it depends on how well you continue to care for and protect your nerves. If you stay consistent with the lifestyle changes that you made to heal your neuropathy, then chances are very slim that you'll suffer a relapse. The problem I usually find is that my patients will be elated and over the moon that they've recovered. They'll tend to their nerve health for about maybe a year, a little longer, and then they begin to backslide. They fall back into their old lifestyle habits. They begin to eat horrible again. They may go back to drinking alcohol. They stay up late at night and get less sleep, and they stop exercising. In my 18 years of experience of working with over 13,000 neuropathy cases, I can say with complete certainty, if you slip back into your old lifestyle habits, your neuropathy will come back. However, you're completely in control of this. Remember, you're in the driver's seat and you don't have to let this happen. We have patients that have gone 7 to 8 years or even longer without any nerve problems. Remember, you're not on this road to recovery alone. We're here to help you. If you get stuck along the way, if you hit a roadblock, just reach out to us and we'll help you get back on track. There are always tips we can share with you that we've used with our patients. There aren't very many cases that we don't have experience with. As always, thank you for watching and sharing your comments with us. If you enjoyed this information and want more like it, be sure to subscribe to our channel and don't forget to like us because it really helps our channel grow. Also, please share this information with anyone you know who's suffering with peripheral neuropathy. I look forward to seeing you on the road to great nerve health. Blessings.
I'll try this.
No, go down. I need you to look at the screen.